Vanakkam. Welcome to this course on biomedical instrumentation. With this video, we start our weekly discussion. In this week, we will discuss primarily pressure measurement, and towards the end of the week, we will discuss temperature measurement. For most of this week, we will restrict our attention to the measurement of pressure or blood pressure. Various other pressures that are of interest, various other physiological pressures of physiological origin that are of interest at various points in time. For example, intrauterine pressure is a pressure that is of interest perhaps during labor, but not during healthy other times, for example. To begin with, let us discuss what is pressure. This is from high school physics. So, when you apply 1 Newton of force over an area of 1 meter squared, 1 meter squared is a very large area. 1 Newton is a relatively small force. The pressure that is felt is called as 1 Pascal. Okay. This is the force that is applied per unit area, because there are several assumptions that the force is uniformly distributed within the area. For example, there are several assumptions, but this need not be true. Over a large area, this is likely not to be true, but for the purpose of human body and the human physiological system, we have interest in pressures in a relatively smaller area, and we have appropriate calibration methods for that purpose. Physiologically, pressure, in this case for example blood pressure and other pressures within the body, are usually denoted in millimeters of mercury or centimeter of water. Of course, there are standard conversion techniques to convert 1 millimeter mercury to kilopascal, 1 centimeter water to kilopascal, for example. So, here is a picture demonstrating how 1 Newton of force, when it is applied over 1 meter squared, you feel 1 Pascal pressure. The demonstration. So, 1 Pascal is actually quite small, but physiological pressures are usually reported in kilopascals. So, 1 kilopascal is like any other kilo. Kilo means 10 power 3, 10 power 3 pascals or 1000 pascals. Most of our interests are in the clinical domain, and clinical readings are usually measured relative to the atmosphere. So, only the difference from the atmospheric pressure or the difference of the pressure from the air pressure is all that matters, is of interest for us. Some indwelling sensors, some sensors that are inserted into, for example, into the heart chamber, usually measure the total pressure, the absolute pressure. So, in such cases, to compare with other metrics, we may need to subtract the atmospheric pressure to get the actual pressure of that particular point, of that particular region whose pressure is being measured. We know that 1 atmosphere is 101.325 kilopascals and 1 bar is 10 power 5 pascals. There are other units of pressure such as kilogram force per centimeter squared, which is essentially 98 kilopascals, Sometimes torr is another unit of pressure that is quite frequently interchangeably used with millimeter mercury. 1 torr is approximately 1 millimeter of mercury. So far we have seen the general definition of pressure and various units of pressure and how we need to use relative pressure for our interest in physiological systems. In particular, one pressure is of interest, that is the mean arterial pressure. This is the average pressure in a person's arteries through one cardiac cycle. What is one cardiac cycle? As the heart beats, let us say, it is a cycle, you could start from any point. Let us start with say for example the atrial systole, that is the contraction of the atrium, to the next contraction of the atrium. Through this time, the pressure, the average pressure across this time is called mean arterial pressure. This essentially accounts for both the pressure during contraction, which is a systolic pressure, and the pressure during expansion of the heart, which is the diastolic pressure. This essentially is a method to see how well various tissues and organs and cells of the body are getting blood. It is a measure, it is an indirect measure of how well various cells of the body are getting their nourishment. Note that blood is the primary supplier of nutrient and oxygen. So, this mean arterial pressure is an indirect, quite indirect, very indirect measure of overall perfusion of organs and tissues. Although it is indirect, it has practical clinical value. It may not be direct in measuring which particular cell is receiving how much blood and how much oxygen and how much nutrient. Perhaps it is not giving you that information, but a drop in mean arterial pressure essentially means that several critical cells, for example the brain, are not necessarily receiving the amount of oxygen required for them. This mean arterial pressure is defined as the systolic pressure plus 1/3 the difference between the systolic pressure and the diastolic pressure. This is the definition of mean arterial pressure, where SP here refers to systolic pressure and DP here refers to diastolic pressure. Several physiological pressure ranges and for various sites at various points in time, at various critical time points are presented here. Arterial pressure, aortic pressure, normal range. We will have to define what is normal here. Normal is over a very large number of people who are healthy, who are otherwise at healthy situation when the measurement is being taken, for example. It is a very specific definition of normal, is 120 by 80, that is systolic by diastolic. So many millimeter mercury, unit is millimeter mercury. This essentially reflects the left ventricular ejection pressure, the pressure at the left ventricle at the time of ejection, systolic pressure, and elastic recoil, which is that is the expansion, which is the diastolic pressure. Left ventricular pressure is at the end of the diastole, just before systole begins, just before contraction, the lowest pressure at the end of the diastole, not necessarily the lowest, at the end of the diastole, whatever is the pressure that is measured, that is less than 8 millimeter mercury. The difference in pressure in the left ventricle between the systole and diastole is approximately 112 millimeters of mercury during healthy face. It's a huge range. See, that is, the heart can take such a huge range of pressures. Already we are having some insights about what a healthy heart can do without even knowing the physiology, without even knowing the details of this. The end diastolic pressure is the pressure just before systole begins, right? That is the pressure before the contraction or the load starts appearing on the ventricle. Peak pressure rate or peak dP by dt is the slope of the pressure curve. This is essentially a signal of how strong the ventricle is. It's a contractile strength. It's a measure of contractile strength. Again, an indirect measure, but still tells a lot about the health of the heart. Pulmonary artery, the pressure is approximately 20 millimeter mercury. This is approximately 25% of the systemic pressure. So, when this increases, usually it refers to, perhaps it points to hypertension or septal defects. Such a deep information we can get about the health by using pressure. Right ventricular pressure is approximately the same as the pulmonary arterial systolic pressure, also noted in millimeter mercury. This is usually lower than the left side, and this is directly measured to assess how well the right side of the heart is functioning. Why is this usually lower than the left side? Something for you to check, because, well, I will say this myself, because the right heart pumps to the pulmonary system, the left heart pumps to the rest of the system. The left heart has to pump, the left ventricle will have to pump until the extremities, whereas the right heart will only have to pump to the right ventricle will only have to pump to the lungs. Okay, but please do read about it more. I am just giving a very brief reason. Please do check why this is the case. Why is it that the left side pressure is much higher than the right side pressure in the heart? Capillary, pulmonary capillary pressure is the pressure value. Usually this value is between capillary values and the left arterial pressure. This pressure in the pulmonary artery usually estimates the left atrial pressure. Okay. And then venous pressure. Note that venous system and arterial system function fundamentally differently. Central venous pressure is approximately 2 to 8 millimeter mercury, quite low. This is the pressure just before the blood enters the right atrium via the superior and the inferior vena cava. These are the largest veins. When the blood enters the right atrium, the preload pressure in the veins is the central venous pressure. Essentially, this is a reflection of venous blood volume and venous tone. A rigorous treatment of the cardiovascular system dynamics and how blood flows is beyond the scope of this course, because this is a course in instrumentation, but I am just trying to touch upon concepts of physiology that might help you understand a little deeper. Please do check when I point to a particular direction, do read up about it on your own in physiology texts, so that you can go a little deeper than what I teach. Intracranial pressure, the critical component. For example, in monitoring how well a person is recovering after head injury, trauma, concussion, tumors, headache, for example, sometimes also used to measure the health of neonates, for example. Intracranial pressure is extremely difficult to measure also, because how do you measure pressure inside the cranium? I mean, it's a huge open challenge in this field. Intraocular pressure, the pressure inside the eyes, for example, is 10 to 20 millimeter mercury. When this increase is above 25 millimeter mercury, essentially points to a risk of glaucoma. Intrauterine pressure inside the amniotic sac, for example, the normal range is between 40 to 80 millimeter mercury. This is essentially the sum of the uterine contraction and the pre-existing intra-abdominal pressure. Intra-abdominal pressure is always there. In addition, the uterine pressure adds to it during labor. Note that this is a critical component that defines and determines what stage of labor the lady is in and what kind of birth the lady will have, and so many things. So, intrauterine pressure is a critical component or a critical parameter. Gastrointestinal pressure, approximately 30 millimeter mercury. This is due to peristalsis. Peristalsis means movements of the gut, movements of the gastrointestinal system, stomach and the intestine at a relatively slow rate by themselves. Unlike the heart, which is fast, it moves at a relatively slow rate. The peak pressure is about 30 millimeter mercury. Bladder pressure, bladder means urinary bladder pressure. Intravesical bladder pressure is about 50 centimeter of water. So, this essentially reflects the bladder tone. Sometimes also is reflective of incontinence, problems with emptying, completely emptying, or problems with continence, ability to hold on to urine, for example. A higher pressure essentially indicates micturition. Intrapleural pressure and intratracheal pressure within the chest sac, lungs and the chest sac, approximately 5 approximately 5 centimeter of water. This varies with stages of respiration, with cycle, where you are in the cycle of respiration, usually is a wider range during maximal efforts. The other point of interest is reference point for measurement. Usually the measured pressure combines true vascular pressure, the pressure of the pressure of the particular vessel that you are measuring, plus gravity and atmospheric pressure. So, if you are interested in measuring the true physiological component, we need to use the right atrium as the reference, because this pressure stays constant with posture. So, you place an external transducer, some external transducer at the center of the fourth intercostal space on the mid-sternal line, that is the mid-sternal line. This anatomical point approximately aligns with the right atrium, whether the patient is sitting or whether the patient is lying down. If you mount your sensor or transducer there, it essentially standardizes the readings regardless of whether the patient, what the posture of the patient is, where the catheter tip is placed. But then again, if the patient moves while the measurement is being taken, then we may need to recalibrate the reference so that the accuracy is maintained. With this, we come to the end of this video. In this video, we looked at basic definitions and units of pressure and fundamentals of pressure measurement, and what are the various physiological pressures of interest for us. And physiological pressure ranges within various points in the body. What are the healthy ranges, what are the non-healthy ranges, which point in the body, which point of the heart, which point in the uterus, which point, where, what values we looked at, and how to measure, what is the reference point for measuring pressure. We said that fourth intercostal space along the mid-sternal line we can use. Although when the patient moves, you may need to realign and re-zero and recalibrate. Otherwise, if the patient is sitting or supine or lying down, this point is an excellent choice for reference point. With this, we come to the end of this video. Thank you very much for your attention.